Hello, today I'm going to talk about how to treat alcohol use disorder. So let's get started. We have three important drugs for USMLE purposes to do questions. Acamprosate and naltrexone as first line, and for second line, we need to know disulfiram. And of course, psychotherapies are really important for treatment of alcohol use disorder. And also, we can use topiramate or gabapentin as a second line too. Acamprosate is a really important drug that reduces alcohol craving, and it is a drug that has effects on glutamate receptors. You may want to remember that there is in chronic alcoholism, the implicated mechanism are associated with GABA and glutamate receptors. So the important thing in here is acamprosate excreted by the kidney. So it is safe in liver diseases, which is really important because patients who have alcohol use disorder generally also has liver diseases like cirrhosis, both in USMLE and real life. So it is really important to know. And naltrexone, other first-line drug we have, is a mu antagonist, and it is hepatotoxic, so it is contraindicated in liver diseases. So we cannot give this drug to people who has concomitant liver diseases. And also we cannot give this drug to people who also use opioid medications for pain, etc. So because it will antagonize the effect of the medication. And the second line drug is disulfiram, and disulfiram is an aldehyde dehydrogenase inhibitor which affects here, and because of that it causes increasing of acetaldehyde, and acetaldehyde is a substance that causes nausea and vomiting and flushing, etc. So the drug disulfiram has an effect as negative conditioning, which is important in the perspective of psychiatry. So the patient should be highly motivated to use disulfiram. And we may use topiramate or gabapentin for people who cannot tolerate other drugs. So you will not probably see a question about topiramate or gabapentin related to alcohol use disorder in USMLE STEP examinations. And please do not forget to give supplements for every patient who has alcohol use disorder, which are B1, B6, B12, and folic acid. And folic acid is the most deficient vitamin in people who has chronic alcoholism, which is important. And the question, which medication should you give a patient with alcohol use disorder who have been experiencing liver disease? So we have two drugs in first line, and we should give acamprosate to this patient because he or she has liver disease also. So we cannot give naltrexone because it is hepatotoxic and contraindicated in liver disease, but we can give acamprosate because it is excreted by kidney. So if a question gives you a patient, gives you a case, a patient also have kidney disease, we cannot give acamprosate. We may also reconsider to give naltrexone. So yeah, that's it. I hope it helps you. If you like my video, please subscribe me, and yeah, thank you.